studies and special studies. So evaluations tend to be bigger, more involving. You want to compare because you're looking at lesson learning and so on. So you do a lot more wider study, not just on the project, but you look beyond. Finally, responsibility. Monitoring tends to be an internal thing. Of course, periodically you may get donors or other people joining your monitoring, but it does tend to be an internal thing you do, and could even be with beneficiaries doing their own monitoring as well and sharing with the project. Whereas external evaluations tend to include, and not only, but also include external evaluators. I personally believe that no evaluation is acceptable if it does not include the participants or the beneficiaries as well as the institution. So even if you're being sponsored by a donor, he or she or they should respect the organization which is implementing the project and work with them to constitute an evaluation team. Next slide, please. So why is M&E important? Now, my cartoon there tells you that, it's an integral part of any project that we have. I remember once receiving someone in the office who was doing some work on M&E in Ghana, and her motivation was that she had come from a donor group in the US who had sponsored a program in Ghana for a number of years. They had been receiving all kinds of reports. And then one day they decided to visit the project and there was nothing on the ground. And they didn't have an M&E plan or anything. The people just claimed they were implementing, they were spending and using everything, only to come out and find out nothing was happening. So M&E is critical. If they had started out with a plan, and it's important that you start from the beginning with an M&E plan, how are we going to monitor? How are we going to evaluate this? So that at the end of the day, when you look back, you'll be able to track your progress, you'll be able to check for achievements, you'll be able to learn. So M&E is for information against the status of the project. It's about knowledge for strategic positioning and capacity building. So if we are not doing so well, M&E will tell us, and then it will also help us to identify where our weak points are so we can build capacity. Of course, as a result, it will influence the kind of decisions we make. And then it promotes accountability, because once you're doing M&E with your partners or the beneficiaries, they get to ask questions. They get to be part of the process of looking at what's working. And then for those of us who look at the bigger goal, it helps with advocacy. If you're doing grassroots level work, then you can come back and look at the national level and say, please, Ministry of so and so, we don't think Agric is working well in the field because we have this kind of evidence. And please note that a key part of M&E is evidence and data. So we need to make sure that as we go along, we are picking evidence and data to make a case. Next slide, please. Okay, so other specific uses is around, I've mentioned knowledge already. So we use the findings to help organizational learning. It also helps us to investigate what is working, what is not, and why is it not working. We tend to stop at the what is working, what isn't working. But for me, the deeper question is, why is it not working? Because if we can deal with the why, then we can solve the other issues. Accountability, it helps us to document, not just for the record and for accounting, but also for institutional memory, so that the next time we are doing this kind of project, we have lessons we've learned from previous work. And then, of course, it's for demonstrating results, and it stimulates stakeholder support, because once they see your reports, they are part of the process. They really want to support because they understand what's going on. Next slide. So, like these children eating from one bowl, it involves everybody. It gets everybody involved. Once you're doing M&E properly and it's participatory, what happens is people are involved, they are empowered on the one hand, but also that they give you more power, more authority, more interest, more support from the stakeholders. And then it builds capacity for development, as we mentioned earlier, because it helps us to understand our projects and our programs. Please go to the next slide. And that's the end of my presentation. I just wanted to give you a teaser, at least start up the discussion on what M&E is and why it's important. And I do hope that as we go into the example that PDA will be sharing, we'll get more insight into how this actually works in their example. I've noticed a few questions already in the chat. I hope that when we get to the session for interaction, we can come back to address these. Thank you very much, and all the best.
Thank you very much, Mrs. Dede Bedu-Ado, for these welcoming words. And just to also remind you that we are being streamed live on Facebook, on our Facebook page, PDA Ghana. You can go there, you can like our page, you can share, and then also get interactive as well. And thank you once again for these welcoming words. And indeed, a key part of M&E is evidence and using data to make changes in the community. So this ushers us into our next session, which is our substantive subject for the day. So I would like to, without wasting time, let me invite Raymond Hodo and Alexander Fram of PDA to lead us in this presentation. Raymond and Alex have been very instrumental in leading some of our key research works in PDA. So they will be taking us through the presentation on PDA's approach to conducting needs assessment, community needs assessment in agrarian communities in Ghana. And if you just joined us, you are welcome to this webinar on conducting community needs assessment in agrarian communities in Ghana. We hope that this will be a platform for all of us to learn and also apply in our various contexts. So Raymond and Alex, if you can hear me, you can begin your presentation. Thank you very much.
All right, thank you, Peter, for the opportunity. Let me share my screen in a bit. All right, so we are having a bit of challenge sharing the screen, but that will be resolved in a minute. So as Peter has rightly introduced, before the screen comes on, the slides comes on, let me first introduce myself. I am Alexander Fram, like Peter rightly said, and I'm beginning the presentation. So PDA is involved in research, monitoring, and evaluation, but in today's section, we are going to focus more on an interesting aspect of evidence gathering before you implement a project, which we call community needs assessment. And then we do this in communities, usually assist our partners in their quest, gather evidence, and design programs and activities that really respond to the needs of those communities. So in the next section, we are just going to run you through how PDA we have been doing community needs assessment, the approach that we have been using, the learnings that we have gathered, and how we have adapted the community needs assessment framework, in Ghanaian agrarian communities. So I'll be talking to you briefly about what community needs assessment is about, and why we do it, the approaches that we have been using to conducting community needs assessment, and then we try to compare those approaches, see differences and similarities, what each approach can do for you if you want to do community needs assessment. Then we talk more about the PDA example, what we have been doing, how we have been approaching community needs assessment in the rural communities in Ghana. And then in doing that, we talked you through about the design, the methodology, what goes into it, all that process. And then we would end with some learnings and takeaways for all of us to be, aware of. So when we talk about community needs assessment, I'm sure we all have a sense of what it is. Essentially, before you go into a community to implement a project or to undertake any intervention, there's a need for you to know exactly what already exists in those communities, what the strengths and the weaknesses are, what resources are already available, from the perspective of different community members. So you want to talk to the children, you want to talk to women, you want to talk to men, you want to talk to community leaders. You want to know exactly what they need, what the needs are. The needs may also vary. They may vary in terms of priority, in terms of urgency. So you need to understand all those dynamics before you can really design an intervention that really works for the community. So these are some of the reasons why we do community needs assessment. And essentially the community needs assessment is about identifying those different levels of needs, those dynamics around the needs, the strengths of the community, the weaknesses, what they already have, and how they can even support the process when you want to implement an intervention in that community. So when you do a proper community needs assessment and you're able to gather the relevant facts and the different dynamics that come into play when you are assessing the community, then you are able to align your intervention to suit the appropriate needs of the community. It's important to remember that even it doesn't matter how homogeneous the community is, needs are always diverse. And when you are analyzing those community needs, you realize that they cut across different teams. Some people will be talking about health, some people will be talking about education, others about maybe their livelihoods, income, some will be talking about environment. So you come across different things, and that helps you to prioritize what you really need to do in the community in terms of limited resources, because as we all know, most of the time the resources are not enough. So it's important for us to prioritize the most important needs in communities. So quickly in PDA and in doing this over the years for partners and our clients, we have tried to categorize community needs assessment into two main approaches. There's one we call the light touch, and there's one we call the deep dive. So essentially the difference is that one of them gives you a general overview and general top level needs of the community. The other one goes beyond that and can give you specific household level individual data, granular data for you to be able to target in case you want to know more insight into the community. So if you look at the light touch version, really essentially what is involved is that you usually do the usual data collection, right? The usual data collection of conducting focus group discussions with different demographics in the community. Sometimes we do things like drawing of dream community. I mean, that's just a participatory element that we add to the process so that people are able to demonstrate what they want to see in the communities. Some of the things that they will not be able to express, they can put it down in a form of drawing, for example, and then you speak to traditional leaders, community leaders, and even local government leaders. So you do all those qualitative interviews, you gather the evidence, the facts at the community level, and then you analyze your results, and that's it. So you see that the light touch will give you general community level information or data on the needs of the community, but may not be able to tell you specifically what's happening in each household. So if you want a more household level data, then there's something that they need to do more. And so the light touch, usually if the client or the partner is not interested in community level household data, we can go with that version. But depending on the need, maybe you want to, let's say, address and mitigate, let's say, child labor in a cocoa community, and then you want to know which households are having had child labor issues or any other phenomena that you want to intervene. You want to know specifically what's happening. Then you want to do more. Then the deep dive is good for you. In that case, we have something we call social mapping and community census. We are able to map up the community. We are able to identify every household. We are able to indicate household composition, wealth ranking, and then we identify whether the household has the particular case or phenomena that you are interested in, for example, child labor, we're able to do all of that for you. Then we do the usual traditional qualitative data collection as well. There's also instances where we can also do reality checks, and reality checks become important where maybe the phenomena you are looking at is so hard to discover, through interviews or by just visiting the community. So when there's a reality check, we deploy researchers, induct them or immerse them into the community. They go live in the community as if they are community members. They do their own thing, and they observe and talk to people and learn to observe things for themselves. So that may also add to the evidence. So for example, there are instances where if you want to, even the child labor example that I gave, you sometimes not be able to, discover the extent and the magnitude of the problem, by talking to people through interviews. But then if somebody goes to observe in the community for a while, they are able to discover more than the interviews will tell you. So if there's time, and if we realize that we need more evidence, which cannot easily be gathered through interviews, then we add the reality check also as another level of rigorosity and triangulation. Then there's also a sense-making workshop, which is also part of the deep dive. This sense-making workshop are usually done at the community level, but also at the district level, depending on the scope of the study. So in some instances, when we finish conducting discussions in the community, you organize selected community members to present the evidence you have gathered so far, see whether it's a true representation of the community, whether there's something that has been left out or something is not even important to be added to the list of needs. And then so we are able to validate our findings there. You can do same at the community level, at the district level, if it's relevant to the study. And then the analysis, as we always do. So the key thing is that if we are doing light touch, you can get some level of community level information. But then if you want to go deeper into household level details, information, identify specific cases that you are interested in, then you go with the deep dive. So quickly, the differences and similarities between these two approaches that I've been talking about. The first one is in terms of profiling, like I said earlier, the light touch, or sometimes you can call it rapid assessment, would only give you community level, high level, needs. But then if you introduce the deep dive, you're able to assess household level, as well as the community level, general information. In terms of the data, the type of data that you can gather, it's the same. Like I said, community level data is what you will get if you are only using the light touch, and then you can get both household and then community level data if you go for the deeper or the deep dive version. In terms of data validation, usually in the light touch, you may not even have time or you may not organize any sense making or validation workshop in the community. But in the deep dive, yes, usually we will do that, and including the chance to even introduce the reality check as well. The research approach, the light touch usually would do just qualitative interviews through focus group discussions, key informant interviews, and sometimes IDIs in some individual in-depth interviews. But with a deep dive, you are able to get all these qualitative interviews that the light touch will give you, plus some quantitative community level household data. So remember I said we do community mapping and then census, right? So that process is able to give us a lot of data, quantitative data at the household level, in addition to the qualitative data that we're collecting at the community levels. In terms of timeline, you need quite a bit of time to do a deep dive study, looking at all the different elements, especially if you want to introduce a reality check, because you usually do about 3 rounds of it, send researchers to the community, they live there for let's say about 10 days, they return, debrief, go there again for about 3 rounds. So you need some time to do that, but you can do the light touch in a very short space of time. So these are some of the differences that we can highlight in terms of the approaches. So now, all that I've said so far are general, they are general about community needs assessment. We now want to move into the PDA experience, how we have adapted or approached community needs assessment in the communities that we have been working in Ghana. So that's the next section. Yes, so the PDA version of community needs assessment is what we are calling the branded approach. Branded approach because we combine elements of the deep dive and then elements of the light touch, to make it more useful. And this is also based on the need of the partner. So we are able to combine. So typically what we do in community needs assessment is that we usually want to include the social mapping and community census. I mean, again, depending on needs and as I'll come to later, the size of the community as well. And then the quantitative or the qualitative interviews through focus group discussions, through key informant interviews are always a key feature of what we do. And then we also do the validation and sense making most of the time. So it's also part of the approach that we have been using. And as usual, we always produce an analysis of the results. So you can see our approach is quite branded. We have chosen elements of the deep dive as I presented in the previous slide, and also the light touch approach. So before I go into the approach itself, the methodology itself we use in doing this community assessment, I think one thing is very important to talk about, and it is how we usually approach the communities that we worked in. So, and I'm sure this we all know, community entry. It's very important if you are working in a community to get started right, to be accepted, and for the people to open up to share their insights with you. It is important that you approach the community right by talking to the right people. This we do at various levels depending on the scope and also the type of information that you need. So that in most of the time, even though you probably will be going to speak to some selected communities, it's important you engage people at the district level, because at the district level, they are the more like gatekeepers to the district. So they need to know what's happening, who is coming into the community, the information you are coming to pick. Sometimes they also have insights, as we will know later, into what you are doing already, which is also a rich resource that you can tap into. And then you have to engage the community leaders, the chiefs, the assembly members in each committee. Depending on every committee has its own dynamic and whom you need to talk to before you can really get access to the community. And mostly, it will be difficult for you to do any engagement if you don't really engage these leaders and seek their consent very well. So it's very important you do that. And then at that level, I mean, even before you engage a community member, it's important that the leaders you are engaging understand your intentions, right? Why you are there, what you want to do, and they need to reason with you. That's what will give you the chance to be able to engage the communities well. So now these are just pictures from some of the very rural communities where our researchers and team members have arrived and have gathered, engaged the community leaders. These are very rural communities, and trying to explain the purpose, just to get a buy-in and to have access to talk to the communities. So now we will talk about the methodology that we have been using in conducting community needs assessment. And largely because community needs assessment really is interested in what the socio-economic, political, environmental needs are in the communities. We usually use qualitative approaches. That is the main kind of data we collect, qualitative data, because we really want insights, what is there, what is not there. But also, as you see in the next slide, we are also much interested in co-creation of things, co-creation of information. And so we don't just extract information from people, but we create a space and environment for them to share. So we also introduce more participatory approaches, and which is why we blend our approach with different elements. So with the qualitative, usually we do focus group discussions with the communities. And these focus group discussions, because we are aware of power dynamics, we are aware of norms, gender norms, etc. We try to break it down into men, so we do separate discussions with men, separate discussions with women, then we do separate discussions with youth. The youth, we could put them into boys, girls, sometimes we can bring them together depending on time and need and availability and all that. But essentially, we collect data using focus group discussions, disaggregated into different gender and demographics. And then sometimes we do in-depth interviews with individuals whom we think have more insights into some of the discussions, right? So beyond the focus group, we can pick some community members and have one-on-one interview to delve more into some of the insights that we want more clarity on. And then we do key informant interviews. This includes, community leaders who are with the chief, it could be the assembly member, it could be the unit committee members, anybody who plays a leadership role in the community, understands community processes and dynamics. We will speak to, at the district level, we also speak to, usually maybe somebody like the planning officer, for example. We are always interested in them because at the district level, they also have their development plan. Usually they have a medium-term development plan that's supposed to cover the entire district, including the communities that you'll be working in. So probably they have some plans already, and they probably already know the needs already. So we engage the community level officials as well in order to get a broader perspective beyond just the few communities you are working in, but also whether there's already some plan in place. If there's a plan in place, then we advise our partner. We can think about how do we leverage on what is already being done so that we don't duplicate efforts and apply resources more efficiently. And then in each community, after we have done 2-3 days of evidence gathering, talking to people, we bring a select few of the community members together to validate what we have gathered. We summarize our findings, we engage them, community leaders, the community members themselves, to see this is what we have from your community. Does it really represent your needs? And then they are able to make input into that, so that before we leave, we are sure we have gathered truly what represents the needs of that community. So like I said previously, we don't just go there, organize people, ask them questions, and then we leave. We've tried to use more participatory approaches, which tends to kind of empower the people to share more, but also we are able to gather more insights and more different evidence if we use these participatory approaches. First of all, you break the power dynamics, people are free to share, and that has been very helpful as well. So some of the things that we do, like I said earlier, is the social mapping and community census taking. But let me say that the social mapping and the community census, even though very interesting, very nice, you cannot do it in every community. So you need to know the size of the community before you think of using a social map or doing social mapping, because by the nature of what we do, the community must be relatively small. And also the community people need to know themselves. There must be that sense of communal living where people know, what's happening in other people's household, their way of life and all of that, so that they can speak to what's happening in people's households. Otherwise, become not so effective. So if it's a bigger community in a peri-urban community where several households, people don't know what's happening in other households, you may not be able to use social mapping effectively. So that's something that we all need to be aware of. But aside that, the social mapping helps us to gather evidence at the community level. So we draw the community map with the community members themselves. We identify every building in that community, every social public infrastructure in that community. We try to identify every household also in the community and the household composition. So how many men, adult women, how many children in terms of, how many children in terms of boys, girls live in the community. If the assessment is interested in a particular phenomena, let's say, or some social events, let's say child labor, let's say child marriage, let's say anything that you are interested in, we can also use the social mapping process to identify households that are having those cases. And then we use the social mapping to also try to understand the living conditions of the households. So are people poor? Usually we categorize them into poor households, households that are in between, they are managing, that's how we usually call it, and those that are affluent or rich. And this we do by asking the community people themselves. So they rank their community households into whether they are poor, whether they are managing, and whether they are rich. That's done by the community. So, but at the end of the day, the social mapping is able to give us some quantitative data, and we are able to estimate the prevalence of, cases of events of interest. For example, child labor, as I mentioned, in the community, if we do the social mapping. So we do that with the community people themselves, and they help us to gather all the facts that we need on that map. So in the next slide, I'll show you an example of a social map. Another thing we have been doing, which usually we add to the focus group discussion sessions, is to add community members to draw their dream community. So imaginary, like, what do you think you want your community to look like? And people will draw very interesting. Give them sometimes flip charts, books, papers, and then markers to demonstrate what they are thinking about, how their community should look like on paper. And people will draw very interesting things that they will not tell you when you just ask them, but they will draw on paper. Sometimes people draw communities that probably have, football stadium, or they have big teaching hospital, they have a university, they have all asphalt roads, very, high level things people want to see in their community. That also help us to understand how people are thinking about the future of their communities and all of that. And then, having gathered so much data on needs, people are telling you, we want clinic to be built here, we want nurses to be posted, doctors to be here. We don't have a GHS, for example, we want it to be want to be built for us. Our roads are bad. People will list so many things. Water. How do we target what needs, really require attention? So we do what we call ranking and scoring of the needs by asking the people to usually list the top line need, things that they consider need to be fixed immediately. So they list about top 3 of them, in each. So we do that with each focus group that we do, for example, and the group will discuss and agree that, okay, we have listed 10 list of things that we need, but we think maybe the water is the number 1 pressing need, for example. Aside the water, probably our clinic needs to be fixed, or maybe our school block is also very important. So it will give you about top 3 or 4 of such needs. And so by picking set rankings from the groups, we are able to determine what we call the short-term needs of the community. Those that, if you have any resource and you want to do any intervention in the community, you really need to target them first. We are able to do that. And then the others are considered long-term. They are important, but we can do some of the needs. We can fix some of the needs before we come to those ones. And then, like I said in the previous slide, which I will not explain again, We also do the sense making to be sure we are captured what truly represents the communities. So this slide is just giving you a scene in one of the social mapping events or centers in the community, one of the rural cocoa communities that we have worked in. Our researchers, together with the community members, are trying to map the community on a paper, and that's what you see. This is more or less like the end product of what they were doing. So this particular map tells you, largely it identifies the houses in the community, the wealth ranking is there, and so on. But like I said, you could add more. For example, to identify child labor cases in the community, to identify some other event of interest to you in the community. Yeah, so the last thing, as I've said, is the sense making. So the only thing I will add is that here we can do the sense making, and sometimes we do it at two levels. The community level one, which we do with every community, and then a general one at the end of the day with the district, people in the district who are also probably working on a similar thing. We engage them usually at the district level to say this is going to the community to speak to all the communities. These are the needs we have gathered, and then they will also look at it and make input and share insight into it. So at the end of the day, we're able to get a more consolidated, verified or validated evidence, which we pick from the community. So these are also scenes from some of the sessions where we're trying to give feedback to the community in terms of what findings you have gathered and how they can also make into that. Yeah, so that's just how the whole process goes. But having done this for a number of times, multiple times with different partners, we have learned a few things that we need to highlight before we bring the presentation to a close. One of the learnings that is that communities do have expectations, and anytime you are there to gather evidence in terms of asking them what their needs are, you raise those expectations. And no matter how you manage the expectations, there will still be expectations. So it's important to always plan to manage the expectations of the people, by telling them, letting them understand exactly what you are there to do, the evidence that you are gathering, what it can potentially do for them, and what it cannot do, so that they don't expect too much, they don't expect, or they don't consider you to be the savior of the community to solve all the challenges. But if you don't manage it well, then it kind of damages the environment for other researchers for future similar studies. Because people tell you, oh, come here all the time to gather or to access questions, but we don't see the results we want to see out of it. So I will also say that usually before you go in to do this communities assessment, and because of the first point that I shared, it's always important to be clear what you want to do with the results. So usually we'll do this when a partner has approached and the partner wants to do something for the communities. That's why we go in to do. So if there is nothing that you have to offer, probably you don't need to take the communities through this rigorous process of identifying their needs. We probably, if you want to just have a study of conducting qualitative interview, that's fine. But if you really go there as doing community needs assessment, then the end results must be something. So there must be something that is driving the assessment. That's also very key. And then usually development practitioners will usually think that, oh, and that's one of the thinkings for many years, that the help must always come from outside. So we identify the needs of the community, but we usually will overlook what the communities themselves will do or can do to salvage the problem. But from our experiences, communities always have something to offer, and they are always willing to also support the process. So it's important to listen to them, to understand what they have, their strengths, what they are already doing, usually when you tap into those strengths, it helps because one, it minimizes your cost, and it also helps to, ensure that there's sustainability. So when you listen to communities, sometimes they list the things that they need, but if you listen to them carefully, they might have started addressing some of them already. Probably through self-help, they have mobilized money. They are trying to put up a school building. Sometimes they don't have money or they don't have anything, but they have the manpower to help you, implement whatever you want to do by cutting down your costs. So you need to understand all those things and to see if you want to come in with an intervention, where do you start from? What can the communities do themselves? And where can your intervention also help? So that's very key, you need to understand. And then, and this is probably why we try to engage different actors and different stakeholders in the community. It is important to hear from different people because different people have different needs, especially those that are likely to be affected by the provision that will come with a needs assessment. We need to hear from them, not only, so we need to be aware of different levels of need and whom is coming from. We don't go just talk to the powerful people and think they know everything about the community, so that's it, we take it. No, we want to hear the most vulnerable, the marginalized, the physically challenged, all of those people, their needs are very important. So we want to, even could be similar need, the same need, but we need to hear from different perspectives, right? Different perspectives. For somebody talking about water, who is able to walk, let's say, a mile to fetch water because physically he or she is active, who approach it differently from someone who probably have a physical disability that would not, be able to help him or her to walk far to fetch water. So different people will approach it differently, and you need to have a better understanding of how you respond to the community by trying to make sure that the different classes of people are well attended to in your intervention. Then one thing I've been talking about is the power dynamics, the different levels of engagement. And sometimes the power dynamics even exist between you, the researcher, or the outsider, and the community people themselves. And there's kind of tension between them and you in terms of they don't know how much they should disclose to you and all of that. So using participatory methods, you're able to reduce that, so that people identify with you, they feel like, oh, we are at the same level, we have a safe environment they can share. So we have realized that participatory methods are really useful when you really want to get trust from the community. You want them to open up more, to share more with you. You need to think about adopting some of the participatory approaches. I mean, there are countless of them. Those that we have used are just examples. There are countless that you can use depending on the community and what works there. And then we need to be aware of the community dynamics in terms of practices, in terms of cultural norms, etc., etc. For example, if you are within a community, you need to know how do we even greet the chief in the community. How do we say certain things in the community? You need to understand those things in order to build rapport, but also to get the consent that you need to be able to do your assessment. So these are some of the things we have learned whilst we engage the communities. Yeah, so I think that's the last slide that I had. So thank you very much for listening to me on this. I hope there will be time for questions and then we can respond to any questions that you have. Thank you very much. Over to you, Peter.
Thank you very much, Alex, for this succinct and insightful presentation. We would like to take questions and answers. But before we do that, just a few reminders that if you just joined us, you are on the webinar on PDA's approach to conducting community needs assessment in agrarian communities in Ghana. And also to note that we are streaming this event live on Facebook at PDA Ghana, so you can get there and be interactive. Share the live feed and also be interactive as well. You can give us your comments in the comment section. And also note that you can get your questions to us using the Q&A button on the interactive menu. And also you can use the chat box to send us your questions. Also note that you are kindly reminded that you should join this stream, this webinar, using the name you used in registering for this webinar. So if your name doesn't match with the name you used in registering this webinar, you can kindly change. You have an opportunity to change. We'll be sending you airtime for being part of this webinar. So kindly change your name if it doesn't match with what you registered with in the registration process. Let me remind you that we have some key personalities on this call. So we have some partners from Beyond Beans. We have our partners from the Department of Children. We also have some partners from Action Aid Ghana, Free the Slaves, Care International, just to mention a few. So at this point, we have loads of questions coming in. So we'll take our time. We have some time to answer your questions. So we'll take our time to provide answers to the various questions you have sent to us. There are questions on this presentation that Alex just made, and also some questions on MNE. So we'll give an opportunity to Madame Dede to also respond to those questions as well. So without wasting time, I would like to go to the first question. So Alex and Raymond, you'll be providing answers to the various questions that have been sent in. So Philip Afran Gazy. So he is asking how committed are the communities when undertaking the needs assessment. So Alex, if you can take this, or Raymond, if you're on standby, you can take this question.
Peter, the question again, please. I didn't.
He's asking about how committed are the community members when you're undertaking the needs assessment, and also the reality checks and how long it takes for you to do the reality checks.
Okay, so how interested and enthusiastic of the community members are? Yeah, usually they are very much interested in sharing with you. And like I said earlier, it depends on how you start the whole process and how you approach the communities. You need to let them understand why you are doing this. Because there are also instances where people feel, are concerned about so much people coming there, so many people coming there to ask them about almost the same thing and not seeing the results. That's why we're talking about you need to manage expectations. But generally, once people understand the purpose of why you're doing this, usually it's interesting and the participation is high. You get the people to, especially when the community leaders have the process. They have given you the green light to engage the communities. Yes, you get the interest is high usually.
All right, thank you so much.
Was there another question that you wanted me to respond to?
Yes, so he was asking about the reality checks and how long it takes for you to do reality checks.
Okay, so it depends, but I think for PDA, usually it will be 10 days at a go, and we do about 3 different rounds. So that will already take you like more than a month, to be able to do that. So we don't just go there one day and return. Like the people will live there for some, at least more than a week or a week to see how the things work in the community. They'll return, debrief. After some time or some days, they will go again to continue the process, another round. So by going there for about 3 times, I'm sure you would have gathered all the facts that they need to gather. Yeah, so, but I think there's no hard facts to it as to you must be there for this number of days. You need to understand the situation, the dynamics of what you are looking for, and then, think through, how long should we stay here to be able to gather what we need to gather. And I think that's all we need to do.
Thank you so much, Alex, for providing an answer to this question. So we have some more questions coming in, and we'll take this for Madam Dede Bedu-Ado, Wamela Rogers is asking what the best practices in M&E are across the African continent.
Okay, thank you for the question, Wamela. There are a number of good practices. I'm a little skeptical of best, but let's just say good M&E practices across the region. And this experience from PDA is a good example. Most of the good practices you will find in M&E are those who promote participation, those which are more open, those which ensure that people actually participate in the process. So they don't just have M&E done to them, but they are part of even developing the M&E plan, part of developing the process, the timing, and so on. So that it's not a domination, but it's something that you actually bring in to assist the community. And if you do it well, it stays with them beyond the project. Increasingly, we are finding also that people use other practices, other African tools and methods for communication, like storytelling, like proverbs, to also help in their M&E and use local languages. So all these are different ways in which people are, tweaking and adapting M&E practices across the region. And in Ghana, you find different examples like what you have here. You have organizations that actually translate all this into local languages so that you are involving the people in a language they can speak and understand properly. And then, of course, there's the documentation, and some use short videos to record some of their good practices. So there are a wide range, and increasingly what we are pushing for now is for more Africans to be part of the M&E process, so that even if it's an external evaluator, it's another African helping an African country or an institution to assess how well they're doing. Thank you. I hope that helps a bit. Thank you.